Media open para ele. Media open para ele.
And register, which almost say it's a representation of about 42%. Until now, say we have a long way to go. Until alongside, registration and renewal of health insurance. And because of the shared numbers, ochna memreda and Sunday, register so that we'll have as many people on board as possible. And media muabwaya and medi Krowa constituency and yadamwasi. Yo meda omwasi biom mrewa nkwakra widowers persons with disabilities, orphans, obi biara oba ha oye potential obetimi benefiting from your social interventions meda omwasi so mwenye abotre ebi mu wo ho a they didn't quite understand near ekoso no but yenya abotre apaipai ana akyerɛkyerɛ eniama mu akyerɛ obia until they know what they are supposed to do. For one reason or the other, no, they couldn't be captured. No, assembly. There's a social welfare officer on board. Then they can also benefit from it.
Looking at Teshia Nungwa, one major characteristic of communities by the seashore is teenage pregnancy. Beyond the dialogue, how are we going to make sure that this doesn't become a 9-day wonder, but then the ministry is going to implement whatever that has been talked about here?
Thank you very much. Aside this particular dialogue, there have been so many community engagements, especially in Krowa. I have a group of people who are teenage mothers. Their intention is to stop whatever has happened, and then the girls can focus on their lives. I started this before I became the member of parliament. The intervention is not only targeted at the teenage mothers, it's also targeted at the caregivers, people, grandmothers who are capable of taking care of the children, and then also other guardians who can take care of the children so the girls can continue with their lives, go to school, learn a trade, anything to cut off the poverty line so that poverty doesn't continue. And so before this social protection came in, there's a wing of social protection. SWES? Yes. SWES was here to also engage them. Usually when people are looking at poverty, they don't consider the coastal communities that much. But when you look at the coasts in Greater Accra, poverty is really endemic. And so all our intervention is to ensure that we either minimize it or we get rid of it altogether. And so that is what we are working towards. This is not just one-off thing. It's a process that will keep going until we realize that the vulnerability is reduced within the communities that find themselves in such situations.
Well, thank you for the good work you're doing for Mother.
Thank you.
There's so many women.